dengue is also a viral infection which is becoming epidemic in our city, but especially it's all over country, but especially it's becoming an epidemic in our city. It's caused by biting of mosquito bites, Anopheles mosquitoes. But the main problem, most of the time it behaves like any other viral fever, but sometimes it can cause complications like bleeding or even shock, and might lead to death. And that's why the panic about dengue fever. But fortunately, most of the dengue fever is not dangerous, and it can be treated like any other viral fever. So people need to know when to worry that when they have a dengue fever. So they should look for basically the warning signs, which are basically like severe abdominal pain, vomiting, unable to eat or drink, or they are not passing enough urine, or if they have any bleeding manifestations. So basically, any child with dengue fever, if he is otherwise well, then their parents need not worry. So only when they have these complicated signs or any other warning signs, they need to have any specific hospitalization. They might need hospitalization. And most of the dengue can be treated at home with just enough fluid given by mouth and paracetamol. Ibugesic or ibuprofen should specifically be avoided in these children. And if they have any complications which I mentioned earlier, then they urgently need to consult a doctor and maybe get admitted. Then they might need some intravenous fluids. The best way to prevent dengue is by avoiding the mosquito bites, because there is no specific medication or even there is no vaccine available in India yet. So prevention is the best way to deal with dengue. But the thing is that people should not panic just on the name of dengue, and should be logical, and basically if they have any warning signs, then they should consult a doctor immediately, but not just because the test has turned positive.